A patient presents with foot drop and loss of sensation on the dorsum of the foot and anterolateral leg. Which nerve is most likely injured? Loss of sensation over the medial malleolus is indicative of damage to a branch of which nerve? A patient has weakness in hip extension and knee flexion, with loss of sensation on the posterior thigh and leg. This suggests a lesion of which nerve is responsible for the sensory limb of the patellar reflex? Injury to the superior gluteal nerve results in the sciatic nerve is actually composed of two distinct nerves bundled together. They are a cyclist experiences numbness and tingling in the perineum and groin after a long ride. Which nerve is likely compressed? Which nerve provides motor innervation to the muscles of the anterior compartment of the thigh? A stab wound to the buttock results in loss of the ability to rise from a seated position or climb stairs. However, hip extension and knee flexion are intact. Which nerve is injured? The sensation from the skin over the lateral aspect of the leg and dorsum of the foot is primarily supplied by which nerve innervates the adductor muscles of the medial thigh? The ankle jerk reflex tests the integrity of which spinal nerve roots and their associated peripheral nerve? nerve entrapped in Morton's neuroma, causing pain between the metatarsal heads is the sensation from the skin over the web space between the first and second toes is supplied by a patient suffers an injury to the lumbar plexus, resulting in weakness of hip flexion and loss of the knee-jerk reflex. Which nerve is primarily affected? The nerve that exits the pelvis through the greater sciatic foramen, below the piriformis muscle is which nerve provides the motor innervation for the push-off phase of walking? After a total hip replacement, a patient reports a numb patch on the lateral thigh. This is likely due to traction injury of a patient with diabetes mellitus develops a painless, non-healing ulcer on the sole of the foot, primarily under the metatarsal heads. Which nerve dysfunction is most common? During a total hip arthroplasty, the surgeon must carefully retract tissue in the posterior approach to avoid damaging a nerve that lies immediately posterior to the hip joint capsule. Which nerve is this? During a total hip arthroplasty, the surgeon must carefully retract tissue in the posterior approach to avoid damaging a nerve that lies immediately posterior to the hip joint capsule. Which nerve is this? A construction worker falls from a ladder, sustaining a pelvic fracture. He presents with an inability to adduct his thigh and loss of sensation over the upper medial thigh. Which nerve is likely injured? A patient with a deep gluteal injection develops immediate, severe pain radiating down the posterior thigh and leg, with weakness in ankle dorsiflexion and plantar flexion. Which nerve was likely directly injected? A patient undergoes knee arthroscopy in the supine position, with the leg placed in a holder that compresses the lateral knee against a post. Post-operatively, he has foot drop. Which nerve was compressed?